Hi, I'm Dr. Mike. I'm the medical director and psychiatrist here at the Proliance Center, and I'm going to talk to you about how to choose a therapist. One of the things that's very important is that a lot of times when people are looking for a therapist, they're looking for a therapist that does a specific kind of therapy. And what I'd like to tell you is that there's many different kinds of therapy, and no one therapy is better than the rest. What you're really looking for is what kind of therapy is the ideal therapy for the difficulty that you're having. Sometimes people know that offhand, and sometimes you really need to meet with your doctor, your therapist, to figure out which would be the ideal therapy that you would need. So for instance, people that have been through traumatic situations or want to get to know themselves better, or they're having some relationship difficulties, could benefit from what we call insight-oriented therapy, which is more of the kind of therapy where you go in and you talk about how things have been in your life, your experiences, and the doctor will listen to you and give you feedback to help guide you in a better direction. This kind of therapy is the kind of therapy that's going to be empowering you to learn to do what you need to do in your life rather than to tell you what you need to do in your life. Another kind of therapy, which is a more specific kind of therapy for specific situations, is a therapy called cognitive behavioral therapy. And there are many different kinds of cognitive behavioral therapy, but for instance, cognitive behavioral therapy would be the kind of therapy when you want to treat a specific problem. So if you, for instance, have difficulty in social relationships, you'd want to have a therapy that specifically addresses that, and that's the kind of therapy that would give you like homework, and from here to next week we want you to do this or that. So those are some of the kinds of therapy. Now there are many others, and we could talk about that at a later time, but that kind of gives you a guide that there is really no best therapy. You just want the one that's best for the situation you have.